Thank you for joining me today. I'll be talking with you about long COVID. I'll start with a description of long COVID from clinical and epidemiologic lenses. Then I'll share why the Utah Department of Health and Human Services is interested in developing a long COVID disease surveillance system. Lastly, I'll share what long COVID disease surveillance entails and the different information systems we're planning for. I'll intentionally call out the relatively new ICD-10 code for long COVID, U09.9, post-COVID condition unspecified, because this code is critical, not only for accurate medical coding and billing, but also for several disease surveillance systems that rely on it downstream. What is long COVID? Long COVID is a syndrome that follows an acute COVID-19 infection. It is also a disability protected under ADA, so formal diagnosis can be very impactful to patients. It is known by different names, including long COVID, what I'll use here, long haul COVID, chronic COVID, post-acute COVID-19, and post-acute sequelae of SARS-CoV-2 infection, or PASC. The definition, like the name, is evolving as we learn more about this condition. How is long COVID diagnosed? There is no requirement for laboratory confirmation of a prior COVID-19 infection. And there is currently no long COVID diagnostic test, so diagnosis is based on clinical symptoms and after ruling out other causes. CDC currently stipulates that symptoms must begin within 3 months of COVID-19 infection and last at least 4 weeks. Symptoms vary from person to person and can range in severity from more mild to severe and debilitating. As a new chronic condition, prognosis is difficult to make. It appears most people recover slowly over a period of months, while a minority have persistent symptoms for years and recovery is unclear. Clinical treatment trials are underway. Currently, symptom management for patients could entail a holistic approach with medication, lifestyle changes, peer support, and physical, occupational, or other therapies as part of a comprehensive plan. This is a list of the many symptoms that could be attributable to long COVID. You can see it can impact various bodily symptoms including neurological, psychological, respiratory, digestive, and others. Long COVID is common. It is highly prevalent among people who had a prior COVID-19 infection, impacting an estimated 5 to 30%. This large range is partially indicative of challenges around diagnosing it. In a representative CDC survey this summer, 19% of the adults in Utah who had a prior COVID-19 infection reported they also had long COVID at some point. In that same survey, 8% of adults said they were currently experiencing long COVID. That nearly 1 in 10 adults self-reported they had long COVID this summer is kind of astounding. Research shows long COVID likely disproportionately affects some populations. Adults seem more likely to suffer from long COVID than children, women more than men. Unvaccinated people and people who had a severe COVID-19 infection appear more likely to develop long COVID. It's important to note, though, that anyone with a COVID-19 infection could later develop long COVID. Moving away from clinical presentation to the public health world, I want to share this new DHHS initiative to develop a long COVID information system. We are in the process of identifying and creating new data streams from several different sources that we hope will allow us to better understand long COVID in Utah and the needs of community members. These different data streams capture different populations in Utah, and they sometimes use different definitions for long COVID, which we hope will help us capture more of the range of long COVID that is experienced. We hope that using multiple perspectives will allow us to build a comprehensive picture of long COVID in Utah that we can use to support clinicians, patients, and public health. We are doing this for a number of reasons. As we talked about earlier, long COVID impacts a high percentage of people. About 1 in 5 Utahns reported experiencing this syndrome. The impact on quality of life can be severe, limiting a person's ability to engage with family and friends, perform hobbies, or other basic activities of daily life. Children may struggle to focus or lack energy to attend school, while adults may be challenged to work. And there are high monetary costs to these limitations. A recent study found 44% of people with long COVID exited the labor force, and 51% worked fewer hours. Another study found treatment costs could amount to about $9,000 per person annually if the approach taken is similar to chronic fatigue syndrome. Additionally, because these patients often have complex medical needs, it places a high burden on healthcare systems. We know not all groups of people are equally affected, but we know less about how this looks in Utah State and hope this information system will shed light on unmet needs. Finally, this is an area of high public, media, and political interest, and we want to be equipped to handle requests as they come in. Overall, we want to use the data generated from the systems to support the efforts of clinicians, social workers, mental health professionals, and public health professionals in their work to address the needs of Utahns with long COVID. We will use it to identify health needs in the community and provide resources. Lastly, the system will generate data that we can use to apply for grants or other funding opportunities to support long COVID activities. These overarching goals will be achieved through our specific epidemiologic goals. We aim to characterize long COVID in Utah, for example, to estimate the prevalence in different counties or by age and sex. We will track these estimates over time to see if and how they change. You could imagine, for example, different variants having different impacts as they emerge. Health equity is an important department priority, and we will use this data to uncover health disparities related to long COVID as a first step towards addressing them. This slide provides an overview of the various information streams we plan to use to build our understanding of long COVID in Utah. First, we are considering building a registry that patients could opt into. This could be used to collect data periodically through surveys and also to disseminate information and resources as they become available and the science progresses. Second, we will use syndromic surveillance, relying primarily on the U09.9 discharge code. We will also look into using a constellation of discharge codes that align with long COVID. Third, we will use all payer claims data, where the U09.9 ICD-10 code is used in billing. This will include most hospital and Medicaid data in Utah. Fourth, we will use electronic case reporting data. We will add U09.9 to an existing data flow so that when a diagnosis is made, it automatically flows into the state's disease surveillance system. Fifth, we plan to use a one-time snapshot of vetted and cleaned clinic data from the University of Utah's long COVID clinic to assess the accuracy of electronic case reporting and payers' claim data. And finally, we will use 2 long COVID survey questions added to the Behavioral Risk Factor Surveillance System, or BRFSS. This is a representative survey that asks people about their health status, beliefs, and behaviors each year. So you can see we're approaching long COVID from a lot of different angles to get a clear understanding for Utah. Since I'm speaking to clinical providers, I want to point out that our main sources of data rely heavily, sometimes entirely, on the U09.9 long COVID ICD-10 code. This data system will only be as good as the data going into it, so I'd like to remind and encourage you to use this code when making a long COVID diagnosis. I'd also like to point out several local resources that are available. To date, 3 long COVID clinics have been created in Utah to provide medical care to patients with long COVID. The COVID Long Hauler Clinic and Long COVID Clinic focus on adults and provide clinical evaluations, resources, and referrals to specialists. The Pediatric Long COVID Navigation Clinic serves children under 18 and provide ongoing symptom management, referring to specialists as needed. There is also a bi-weekly clinician lecture series called the Long COVID and Post-Viral Syndrome Series. It is co-produced by the University of Utah and Bateman Horne Center. The link is shown here. It's partially a didactic lecture and partially an opportunity for community providers to present challenging cases and get input from others who are treating long COVID patients. Lastly, there is a peer support group for people grappling with the emotional impacts of long COVID. Thank you for helping us care for people with long COVID. Please let us know of any additional resources you have identified, and please use the U09.9 code as a diagnosis code when you are treating people with long COVID. I invite you to contact me at the email shown here if you'd like to discuss this further. Thank you for your time.